feels great to be back. Welcome to Because Belen, the official Belen Alumni Podcast. My name is Bryan Herrera, and today we are sitting with Kenji Martinez, also known as Dr. Kenji Martinez, from the class of 2013, a doctor specializing in wellness, health, and community, chief resident of a family medicine program here in Miami, and a doctor that seems to have a focus and a passion on making valuable content. Welcome to the show, Dr. Kenji.
Thank you so much, man.
Thank you for taking the time out of your busy schedule. Yeah. And I'm sure it'll be a entertaining conversation, but also informative, which is awesome. We'll be reminiscing on some Belen things and speaking some health things. So let's jump in. Before we get started, quick reminder, please follow, share, comment wherever you choose to hear this podcast, whether it's audio. If you are hearing our original format on the audio, be aware that we are also on YouTube now. And if you transfer over there, you'll be able to see our faces and our nice Belen polos. So, all right, let's begin. Before talking Belen, I want to jump into a topic you are extremely credible speaking about, naturally, as being a doctor.
Okay.
One that's valuable for all of us, and that is health.
Yeah.
Okay. I stalked you a little bit yesterday, okay? IG bio-wise and see what you're, all about in the source of the content.
Sure.
And you had a very interesting bio. On a mission to break barriers and translate doctor talk so it makes sense. Yeah. I can't agree more, right? How many times have we gone to the doctars and been like, what is this guy talking about?
All the time, man.
Looking at the charts, right? Like, yeah, you tell me what it says. We'll figure it out, Why is this important to you?
Yeah, man. So I've always thought that medicine and medical education doesn't just belong to doctors, nurses, anyone that works in healthcare. I mean, it belongs to everyone.
Yes.
We should all feel empowered to understand the why for certain things. It's very easy for me to tell someone to do something, to make a lifestyle change or to take a medication. But if they don't understand the why behind it, they won't take initiative or they won't take it seriously. So like you said, doctor talk, nurse talk, it's all intimidating.
Yes.
And I want to try to break that barrier. I want to make it not as intimidating and make it easy for people to understand, again, the why.
That's amazing, because there's been times where, if the why's not explained and you try to have the conversation, but you almost don't know how to answer or what to say.
Absolutely.
And there's been times where I leave the doctor's office more confused than when I got there.
Yeah, absolutely. Right? And you don't feel like you have a grasp of the plan. You don't know what to do next. So it's like taking a test, I guess, like in Belen, you can memorize answers,
right?
But the next day you forget.
Yes.
When you conceptualize and you understand things, that's when it really sticks.
Not that we did any of that when we were there, but it happens sometimes. I hear that it happens. So that's awesome. And what inspired you to pursue medicine per se, like as an overall blanket?
Medicine has always been something that I've always been interested in. Sweet. As a little kid. I feel like it was the thing that allowed me to serve the most, to give back. So I always found it, beautiful to be able to work with people that needed me, that needed help, that were sick, or just needed someone to listen to. So as a little kid, I've always kind of gravitated towards that.
No way. And is this something as a little kid that you knew you wanted to be a doctor, or just that you liked it and let's see what happens?
Yeah, kind of. I've always wanted to help people some way or somehow.
Sweet.
Yeah.
Sweet. Well, that's interesting. And meant for others and the
Absolutely.
way we serve, naturally ties together. So were you a lifer, Belen, like sixth grade?
Yes.
Or just high school? Yes?
Yeah.
Okay, so awesome. That's the formative years of sixth grade where, you're tying all these thoughts together and then you're also hearing it in school, and it definitely adds on to the why, right? So that's amazing. I spent some time on your Instagram, like I said, okay? So I want to kind of go over some of the stuff you're putting out, right?
Okay.
Particularly 4 or 5 that I wrote down because I saw these videos.
Sure.
And I saw the why in these videos. Like, why would you do this video?
Awesome.
And it made sense to me.
Cool.
I also learned a couple things from it.
Great. Good.
So I think it's great to kind of cover these topics and see if, maybe the audience can learn a thing or two as well on this podcast.
Hopefully, yeah.
All right. So first I want to start off with, I've done hospitality management in the past, right? Managing venues, et cetera.
Okay.
And there's been times where, someone just drops and has a seizure.
Yeah.
And it's a scary situation, especially the first time I saw it, whoa, what's going on, right? So you had one of the videos where you were, what to do if somebody was having a seizure in front of you. What's this all about and how does that work?
Absolutely. So these are real life scenarios. These are real life situations. Like you say, it can happen at work. It can happen on a football field. It can happen anywhere and to anyone. That's the craziest thing, right? I feel like when something like this happens, it's shocking to people.
Right.
People don't know what to do. And unfortunately, when it comes to something like this, time is life. Time is of the essence. So I want to give people a basic understanding of what to do so that they feel confident in the case that this were to ever happen or they encounter a situation like this, they know what to do. Because this can happen to a family member. This can happen to a coworker, like you said, at work or to friends.
Right.
So having that knowledge and that confidence of knowing what to do can save someone's life.
Does the same thing that you went over apply to animals, let's say? Because my dog's epileptic. So,
Oh, wow.
oh man, first time it ever happened, you think the worst, right? But then you start, kind of understanding what's what.
Yeah.
Is it kind of the same thing with animals or exactly the same thing?
I'm not 100% sure if it's exactly the same thing.
Okay.
Again, animal medicine is very different.
Right.
But I would assume it's kind of the same thing. Yeah,
All right. And so you covered SAFE. Why don't you explain that? What should you do if somebody is having a seizure in front of you?
Absolutely. So SAFE is an acronym that we kind of came up with. I had some help with other doctors as well.
Sweet.
And the first thing that anyone should do in an event of a seizure is stay calm. There's nothing that you can really do to stop a seizure.
I failed big time my first time seeing it on that, by the way. I panicked.
Yeah, exactly. And that's a normal reaction.
Yeah.
That's obviously, and even in the hospital, the first time I encountered a person or a patient having a seizure, you automatically freak out.
Yeah.
But the first thing you got to do is stay calm.
Okay.
Stay relaxed, stay calm, and be there for the person. The other thing is you want to try to assist the person as much as you can. And by assisting them is that, if they're sitting on a chair or anything like that, try to bring them down to the ground. Because if they're on a chair having a seizure, they're more likely to get hurt.
Okay.
So you want to try to bring them down to the floor and then put them on their side. If they start having a seizure on their back, during an episode, they could have saliva. They could even have some vomiting.
Okay.
So by putting them on their side, you're actually preventing them from swallowing it and aspirating and all those complications.
You could choke on that at the end of the day, right? That's the idea behind it?
Absolutely.
Sweet.
Absolutely. And then another thing too is that if you're, let's say, in an office space or at home, you want to try to free the area from different things as well. You want to make sure that there's nothing around the person that can cause them harm. If there's a chair or a table that they can bump their head on or anything like that, you want to try to remove that. If there's like you're in a public place, take people away from them as well.
Okay.
Everybody loves to crowd and see the show. Tell them, hey, take a step back. This person needs some space.
Right.
So that's what F is, free the area and kind of like that. And then the other thing is to evaluate the situation as well.
Okay.
I always tell people that if they see someone having a seizure, please get on your phone or on your watch and try to time the seizure. If a seizure lasts more than 5 minutes, it's very important that you call 911 right away.
Why?
So what happens is that during a seizure, if it lasts more than 5 minutes, there's a lot of brain injury. So your brain loses oxygen, blood flow, and things like that. So in that instance, they require medications, really IV medications fast. They're going to require probably to be intubated. It becomes a lot more complicated.
Nice. Well, stay safe, right? At the end of the day, if you're ever
Absolutely.
encountering it, remember the acronym. And more importantly, I think is the last part, right? If it's something that lasts a little longer, 5 minute mark, don't think it's all right when it passes because we don't, know what might happen post trauma, right?
Exactly.
So amazing. So on that same, not same topic, but same direction, I saw the difference between heart attack and cardiac arrest.
Yeah.
Okay. And honestly, I thought it was the same thing until I saw your video.
Awesome.
Right?
Oh, yeah.
So
Yeah.
how do you distinguish the two? What's what?
Yeah. So I'm really glad you saw that one. And that's a very common misconception we see all the time. A lot of people think that they mean the same thing, that a cardiac arrest is a heart attack.
Right.
But on the contrary, they're actually very different. So a heart attack is what you see basically on TV shows, what you see like, the person clutching their chest in a lot of pain. They feel like someone's sitting on their chest. That's a classic heart attack. And what happens is that there's a blockage in the arteries. So not enough blood is going back to the heart. So the heart is getting damaged. And that's why they have that significant pain. So
Is it like a pressure pain, you would say?
It really, really is different. So for men, most commonly, it's described as a pressure, sharp, stabbing type of pain. But for women, sometimes women actually feel epigastric, so stomach pain. They actually feel sometimes pain in their jaw too, or weakness. So it really presents very differently.
And where does the arm myth or reality come from, right? It's one of them goes numb or something?
Absolutely. So the most common one is that you start feeling your left arm. Yeah, goes completely numb. And you can remember that because your heart is on the left side.
Got it.
So usually this arm, the left, is what usually goes numb. But again, it presents very differently for a lot of people.
And so that's the heart attack. What about a cardiac arrest? What makes it different?
Yeah, so a cardiac arrest, in a heart attack, your heart is still beating.
Okay.
But in a cardiac arrest, your heart actually stops beating completely.
Got it.
So in a cardiac arrest, that is basically the person doesn't have pain. They just lose consciousness because their heart stops.
Got it.
So it's arrest means stop, right? Cardiac arrest. Mm-hmm.
Amazing.
Yeah.
Amazing. I'm so glad we're covering these topics. I know they were new to me. So they're got to be new to some of the listeners out there,
Absolutely.
you know? So, all right, we'll go to another one that I found extremely interesting and in your field, I'm sure there's a lot of insurance talk.
Oh,
right?
man.
So this might help those with certain copays for different type of things, right? And it's the difference between when to go to an emergency room and when to go to urgent care.
Sure.
Right?
Yeah.
And so what would you recommend and how does that work typically on how to be aware of where to go?
Yeah. So this video for me was near and dear to my heart. I thought it was very important because in residency, I spend a lot of time in the emergency room. And I see a lot of patients come into the emergency room when in reality, they didn't really need to. They just didn't know any better. They didn't know which direction to go. So an urgent care, I would tell people, is if it's a condition that is not life-threatening.
Okay.
You know, let's say, if you have a cold, by all means, I would first say, talk to your doctor, talk to your healthcare provider, whoever sees you, and see if they can help you with that. But let's say you have severe stomach pain. You have stomach pain that you've been, I don't know, throwing up multiple times a day. Now you have fever. It's something you cannot deal with. Then I would say go to the emergency room. Because the urgent care, there's only so much they can do. The urgent care is good for like a quick prescription or maybe a quick x-ray. But if it's something life-threatening, something that you really feel like, okay, I need help, straight to the emergency room right now.
Is urgent care prepared to do things like I broke my arm or I think I did? Is that something that you should go urgent care or emergency room?
It's very difficult to say. So in urgent care, what they can do, let's say break your arm, like you said, they can probably do an x-ray.
Okay.
But when the results come back, if it's something that they can't do, let's say it's a bad fracture that requires surgery, they'll most likely send you to the emergency room.
Got it.
So urgent care, again, is very, very basic. It should be for very basic things. If it's something, let's say a really deep cut.
Okay.
You know, very, very big cut. Thanksgiving is a big one. Somebody cuts their finger off. Don't go to the urgent care. Go to the ER.
Got it. Yeah, you waste time going there and then they send you kind of to the ER anyways and you don't know what that time is, right? You know, the damage it may do. So that's happened to me on the first example you said, right? Stomach pain, throwing up, you don't know what's wrong. You know, I finally, all right, you know, this isn't going to pass. Let's go to urgent care. You know, you make the will, you get there, and then they're like, yeah, you're pale and you're dehydrated and you need to go to the ER immediately. And I'm like, I should have driven to the ER in the first place, right? So I can see the difference between the two now. And again, extremely valuable to not waste time, but also on the other side, not, you know, take up space in an ER when you don't typically maybe have to be there and others have a more severe emergency, right? So I can see it both ways there.
And that's the biggest issue, said that a lot of emergency rooms are oversaturated and they are dealing with real life emergencies. With cardiac arrest, they're dealing with heart attacks, they're dealing with people who have COPD and they can't breathe.
Got it.
So if you go to an emergency room, let's say for, I don't know, like flu-like symptoms, expect to stay in the emergency room for 6-7 hours sometimes because you're not really their priority. An emergency room really is for emergencies. You got me? An urgent care is more for basic things. And one thing I tell people all the time is have a good relationship with your healthcare provider, whether it's a doctor, nurse practitioner, whoever it is, because if something not as emergent arises, you should be able to talk to those doctors that take care of you. So as a family medicine physician, you know, I give my patients access to me at all times.
Love that.
Because if there's something they need, they can always reach out to me and I can help guide them to a better decision.
Love that. Love that. And I've seen in the Belen Network a lot of that, you know, brotherhood that we stand for, but beyond that, right? Where I've noticed changing from one doctor to the next, right? Out of Belen Network to Belen Network. And like that hands-on kind of experience that really means a lot when you're going through it and you need that attention, right? You don't have 7 days for the next appointment, right? Or in a good situation, right? Some are months, right? And it's like, how do I do this?
Yeah.
So that's amazing. You pointed out.
Yeah.
The next one is I think, health is a common topic that is a trend almost now, right?
Yeah.
Eating healthier, working out healthier, being healthier, right?
Absolutely.
And then you have the myth, I guess, of how much exercise is good, how much is bad, right? Yeah. Do I need the $1 million trainer and go up the I don't know what mountain and and so a lot of that kind of goes in conversations that I've heard. So from someone with your experience, I wanted to see regardless whether you're looking a certain way, gaining weight, losing weight, right? These things vary, but when it comes to just being healthy, right? Not looking at your best, not competing at your best. These are, I guess, different topics, right? But if it's just healthy, what does that look like from your expertise? And what can people do to stay healthy nowadays?
Yeah, absolutely. So there's a famous quote that I love, and it says, "The doctor of the future will not be prescribing medications. They will be prescribing a lifestyle." And to live a healthy life, you have to be consistent.
Okay.
It's a lifestyle. It's not a one day I'm going to eat salad and then the next 6 days I'm going to go to, Flanagan's, which I love. Don't get me wrong. I love Flanagan's and things like that. But it's to create habits, little habits today that tomorrow make a big difference.
Got it.
So every day be consistent. When it comes to exercising, of course, everybody wants the $1 million trainer. Everybody wants the $1 million equipment because it looks pretty. But if you buy it and you spend $1 million and don't use it, then what good is it, right? I'd rather walk around Tropical Park with my $15 sneakers that are free, and feel better about myself. So exercising doesn't have to be expensive. Dieting doesn't have to be expensive. What you just need is consistency. You just need to make certain little changes in your lifestyle that make a big difference.
I love that because sometimes it's hard to start because of that, unknown.
Yeah.
Right. Like, I don't know how to work out at the gym.
Right.
I don't know what I should be eating.
Yeah.
And I think, at the end of the day, if you, like you said, just pick something, be consistent with it, and then little by little improve on it. Right. Okay. I'm eating a little better.
Yeah.
All right. I'm dieting better. Now, how can I tone it a little bit more? How can I do this? Now I'm more familiar with it. Maybe I'm more interested in it. You see a lot, right?
Correct. It's a lot of trial and error.
Yes.
What works for you?
Yes.
So when I sit down with my patients, the thing that I try to do is I make it patient-centered.
Okay.
Okay. Because you are going to be completely different than my 70-year-old patient that I have.
Right.
I can't tell him to exercise 5 days a week, but I can tell him, hey, look, but you can walk around for 10 minutes a day. And that's enough for him.
Buy a dog because my dog makes him walk him 3 times a day.
There you go.
So
yeah,
that
absolutely.
could be a good one.
Yeah, dogs are fantastic, and they help with the brain too.
Absolutely.
Dogs are fantastic. I love dogs.
Yeah.
But
you can tell by my animal questions that
clearly.
The dog owns the house. I just live there. Something I didn't see on your page, but it's a popular topic within the community of working out and health, and the topic we were just on. So I'm curious. This is selfish. This is my question, right?
Yeah.
Okay. Cold plunge.
Oh, okay. Yeah,
right. Hot, cold recovery. What's your opinion on that? What's the right way of utilizing it? Pre-workout, post-workout, end on cold, end on hot, 3 minutes, minute and a half. What is it? Because I've heard it all at the gym myself.
Okay. So this is something I love to talk about as well, because again, it all depends.
Okay.
Right. Not everyone can tolerate a cold plunge, and not everyone should do a cold plunge.
Okay.
Cold plunge, like you said, wellness.
Please tell me it's not good for me so I don't have to do it again. Please tell me that I'm the guy that it does not apply for, please. Because that is a miserable process that I've learned to be consistent with, but my goodness.
Yeah, it's hard, man. It's hard. There's a lot of, there's been studied a lot of health benefits for it. Right. But if it's not something that works for you, then why do it, right?
Sure.
Wellness, I like to tell people all the time that everyone that talks about wellness has their own agenda as well. We have to not be skeptical about people, but again, it goes back to the why. Okay. We need to question why. And if you're going to do things like cold plunges, I really recommend before you do it, talk to a doctor.
Okay.
Talk to your healthcare provider and see if it's right for you. There's actually conditions where people, like their blood vessels, for example, right? They constrict normally. So their extremities become blue and they have a lot of pain. So when they go into a cold plunge, it becomes miserable. And they should have been told by someone, hey, that's not right for you. You don't have to do that.
Is that the theory behind the cold plunge? It constricts the blood flow?
It does.
Okay.
Yeah. And then what happens is a lot of your hormones, your endorphins, start going up.
Okay.
Right? Like your norepinephrine, your epinephrine, so your adrenaline hormones go up because it's so cold, right? So
that shock, right?
That shock, exactly.
Yeah.
So yes, it's beneficial, but it depends, right? It varies on the person. So I would just talk to someone before you do it.
Pre-workout or post-workout? What's the purpose of it besides being miserable?
I would say post-workout for recovery purposes.
Okay.
If you do it before a workout, right, your muscles are going to be tight, your blood vessels are constricted. You want more heat, which is why people say you want like an active aerobic exercise to get your blood flowing.
A little warm up.
A little warm up, exactly. You don't want to be cold and constricted before warm up. You could injure yourself if you do it before. But afterwards is usually recommended.
There you go. So you see, there's a theory that's been solved, at least for me on this one.
There
right?
you go.
At the gym, I hear all the time, no, pre-workout because the shock and it works you. I'm like, drink a pre-workout then. That's what it sounds more like. Do whatever that makes sense, right? But like you're cannonballing into 30-degree water and then you're gonna go and squat. I mean, I don't know that the knees are good for that. I don't know. So I wanted to ask. All right, if nobody learned anything, that's a me question. It's all right. Outside of these, and the answer might be no, and I'll be fine. We'll move on. But in case there are maybe some videos you're working on that aren't out yet, are there any medical topics you're passionate about educating the public and may want to discuss and include in this segment?
Yeah, absolutely. One is community.
Okay.
And community is a big part of just feeling well, being well. During the pandemic, what I realized, I did a lot of my medical school education, so my rotations during the pandemic.
Wow.
And what that taught me was that we became very isolated and mental health took a big hit at that point. We started seeing depression rise. We started seeing anxiety rise. And I think that people need to find a purpose in life. In Japanese, it's called ikigai.
Okay.
And ikigai means my purpose. Father Willie actually in Belen used to talk about vocation all the time, right? And vocation is like a finding something that you want to work for, that you're passionate about.
Purpose.
A purpose.
Yes.
Exactly. So going back to purpose and community, I think people need to involve themselves in something like that because that brings so much strength and power to their wellness. That's huge. So, we talk about the Belen community all the time. And there's a reason why you go to Tombola and nobody is sad, right?
Yes.
And you go to Tombola and the energy is like crazy. But again, it's that community. And I think we're very blessed that we have that.
I love that.
I hope to make videos about that so people can learn more about it and find a community, find something that works for them. Yeah.
I love that, man. And for the Belen listeners, Be Connected is out there to kind of help you stay connected and be in the community of Belen post-graduation. And I think it's extremely important. I have found all my doctors,
there you go.
Attorneys, Be Connected, know, and at the end of the day, it's that simple intro of like, hey, I'm class of 06, Belen.
It's amazing.
How's everything? You got anything? My bro, hey, I come in, and you're in good hands at the end of the day, right? So,
absolutely.
All right, so I want to kind of, similar topic, but transition a little bit, and this is more of the approach you take on the marketing.
Okay,
very modern, right?
Sure.
Millennial.
Very.
But nonetheless, I think it's very beneficial.
Thank you.
Right? I think it's extremely not just beneficial to you, right? I'm sure you get patients all the time that call because they saw something or someone sent them something, but beneficial to the community, which naturally you're big on and we just spoke of. So in what ways have you seen it benefit you?
Yeah, absolutely. I feel like it's taking down a wall.
Okay.
For me. There's something that exists called white coat syndrome.
Okay.
When you go to the doctor, you start getting anxious. You get nervous because you don't know what to expect.
Guilty.
Right?
Yeah.
It happens to everyone. It even happens to me. And I go to see my doctor. I'm like so nervous, am I doing things right? Am I doing things wrong? But these videos that I make, like you said, they're a little goofy.
Sure.
You'll see me dancing and things like that.
You got some moves though.
Oh, I appreciate you.
You got some moves.
I don't know if they're good, but they're...
No, I didn't say they were good. I just said you got some moves. No, I'm kidding.
Yeah, I do something
phenomenal, man. Phenomenal videos.
Thank you, man. But I want to try to, break that barrier and show people that we're people as well. I'm just a normal guy. I like to have fun. I think it's an interesting way for people to learn. You know, it's very simple and easy for me to sit down and just lecture to a camera. But, you know, if you see me dancing and you see me, I don't know, talking about the urgent care versus emergency room, you're more captivated to listen, to watch. And I feel like you're watching almost like a friend.
We have never met before today.
Yeah.
When you showed up, I felt like we were in class together for 7 years.
Yeah, I got that same vibe.
You know what I mean? That confianza, like you almost... you know the guy based on what he's willing to put out and how he's willing to put it out, right? And at the end of the day, there's a lot of character and personality that goes behind that, right? Because it's not like we're shooting a Steven Spielberg movie, right? You know, so it's like you came up with that, you put that out, and I learned from it. So there's already that what's the right word? Relatable.
Right, exactly.
We're very relatable at the end of the day, regardless if you've met or not. And when you do go to meet, you know, you have a little less of that white coat syndrome.
Hopefully,
and by the way, I've never heard a doctor talk about going to the doctor. So
there you go.
Very human to hear as well.
I'm glad,
Right? Where do these, so like I said, you know, I'm going to guess the ideas come from you, right? We don't have a whole production team and marketing team, right?
No,
one man show like all the others.
Yeah.
Where do the video and ideas come from?
So I've always been passionate about music. I love music. And I know that music makes me feel good. So when I hear a song that catches my attention, like for example, the urgent care and ER video I used, You'll Make Me Feel Good by, what is it? Hall & Oates.
Yeah.
The singers, right? So that song makes me feel good. So I thought, okay, it might make other viewers and followers feel good as well. I love dancing. I feel like dancing is a way for me to express myself, even though it might not be the best dancing, but it's fun.
Hey, it works.
It works.
Yes.
It gets the job done. And it's something people enjoy watching.
I think it makes you a human as well.
And
you're
that's
in your
the thing.
scrubs, you look like a doctor, you sound like a doctor.
Yeah.
Then you're acting like a human at the end of the day, right?
And that's the goal.
That's the
I
goal.
want people to understand that I'm not some scary figure. I'm not here to judge you. I'm here to have fun and work with you.
Love that.
That's what a doctor should be. Yeah.
Love that. So would you say you have the song in mind first before even the idea or what you're going to talk about?
I think so. I think
That's amazing.
it usually comes with the song and then everything else follows. So yeah.
That's amazing. We'll get to one, you know, there's one of these in here, one of these topics that touches on that, but it's kind of like getting started.
Okay.
Right? That's the hardest part.
Yeah.
And so if you hear a good song and it gets you started, what best way to do it, right?
Exactly.
And it just now gives you a reason to listen to good music.
Exactly. Yeah.
So, you know, actually we're getting into that right now. So a lot of people want to do this. You know, I hear all the time, we need to do better marketing. You know, I need better content about what we do, regardless if you're a chef, an attorney, an accountant, you know, anything in between. But then one of the thought processes, man, how complicated it is, right? How hard is it? Because if you've never done it, you don't know it's as simple as setting up a phone,
Right.
grabbing a wireless mic if you want to. You don't even need it, right? And just doing it.
Yep.
So for I can see, and I'm one of these people, by the way, super guilty. Just a couple months ago, before getting a little more involved, it's just it gives you the reason to not do it.
Yeah.
Right. So I guess the question here is, what's the process like for you? Right. You spoke about the music. Okay, what comes from that, and not so much to where the idea comes from, but the physical process, right? How do you record it?
Yeah.
How do you get the audio? You know, do you worry about lighting? Do you pick a place based on it? You know, how does that whole process work? And then I want to follow up on that question with, would you encourage everyone to get into it, right? The cold plunge isn't for everyone, but is good content good for everyone?
That's a great question, man. So it's kind of a heavy question, right? To get started, like you said, doesn't take much. I bought a tripod on Amazon that's like probably $15.
Yes.
And I use my phone most of the time.
Nice.
And then I have my laptop on the side playing the songs while I dance.
Okay.
For editing purposes, I use the free Instagram Edits app. So I don't even pay for like an editing software or anything like that.
A phone you already own.
Yeah.
Software that's free.
Correct.
A good song that just, you know, hopefully your ear is free.
Yeah.
and a $15 tripod so far from what I'm following.
Pretty much.
So for $15, you can be on your way, but let's keep going down the process.
Yeah, absolutely. So then I guess when I start filming it, my wife is hilarious because she tells me, you need better lighting, you need this, blah, 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 blah. And I'm like, no, it's okay. I know what I'm doing. I know it's me. It's me. And I tell people all the time, you know, what makes content special or unique is that, again, it is you. Right. It's me. This is genuine. This is who I am. Like you said, it's not a Steven Spielberg movie. It's not a multi-million-dollar production. It's a $500 iPhone that I didn't even pay for. My dad paid for.
Right. There you go.
That my parents paid for. Exactly. Shout out to him, man. But it's just who I am. And I hope it comes off like that, like genuine. I'm a huge fan of, yes, I love watching movies, but I love watching the behind the scenes more.
Love that.
I do. I'm a big fan. The process, absolutely, because that's the beauty of it.
I think that's the art.
That is the art.
Yes.
Absolutely. Even I love sports as well, right? The Last Dance for me,
okay,
the Michael Jordan documentary was amazing because we did see the process that it took for him to get to the level that he did.
Yes. And it also killed a lot of the stigma of like the bad things that people would say about him. It's like, hey, bro, the guy's the best for a reason. Imagine showing up to practice and being like, we're going to be kind of good today. You're not going to be the best.
Right.
That's for sure, especially when there's people like him out there that are like making things up in their head to get going. Yeah. You got a special type of, I want this in you to do that. Yeah. And documenting that is amazing. I'm so glad that, 30 for 30 and all these series are coming out.
All these great shows. Yeah, you see the process.
Love that. So, and I mean, society wants it because more and more of those shows are coming out. Yeah. So it shows that what we're talking about is relevant. And hopefully this, encourages somebody out there that may feel like the content isn't good enough. Yeah. If it's good for you, it's good. Put it out, get it going, 1,000%. And see what comes from it. And your first post is not going to be your best one for sure. Absolutely. And I think it's over, for me, for example, I mean, the hardest thing was overcoming that fear. That fear of, are people going to accept it well? Right. Is it going to do well? It's not. More than likely, right? Maybe you get lucky. And who cares? Right. Who cares? At the end of the day, I'm happy with what I put out. Yes. I'm okay with what I put out. I'm just content. And whoever finds it interesting, whoever learns from it, if one person learns from it, I did my job. You just nailed it where I was going. It's to me, it was like, I always had everyone in mind when I was in that scared process. Yeah. And now it's like, well, I'm not thinking of anyone. I'm thinking of the one person that it could help or entertain or educate or motivate. Right. And at the end of the day, that's good enough for me, right? I don't need a billion streams on something, It'd be great to get it, but imagine getting a billion streams and it sucks. Like, exactly. Wow, that might be good for something. Exactly. So, all right, so let's transition back out of my selfish topics. What would you advise to somebody out there that has been thinking about it and just hasn't done it? I would say just do it. Just do it. Nike has the best. Oh, we're Nike'd out here. Just do it. Exactly right. Oh no, this is Under Armour. Under Armour. I checked. I was. But yeah, man, just do it. Love that. Yeah. Ending on the marketing topic is, again, just a personal question. I want to know, because I did spend a lot of time on your Instagram, right? Okay. I would break down, you have educational videos, like the ones we spoke about, like SAFE, the acronym, entertaining videos, like taking a shot of coffee at 3:42 a.m. in the ER room, right? Yeah. That must have been enjoyable for your colleagues and your coworkers that day, right? They had a fun time watching that one. Yeah, and then you driving them crazy after that. Or the third is motivational, like Patch Adams' speech, which is touching and gets the motion going, right? Gets the why, and why, or better, let's start with what's your favorite, and then why is that your favorite? Favorite what? I'm sorry. Oh, favorite the type. Favorite type? Yeah. Educational, entertaining, or motivational? It's hard to say. I want to and try to do all three at the same time. Okay. Because they're three components, they're three like pillars, I guess, that are so important. And they're three things that talk about who I am. So with that Patch Adams video, it was motivational, but I want people to see where I came from. I want them to understand what got me to love medicine. And believe it or not, that movie when I saw as a kid, that's really what triggered me. He's such a legend. And I remember seeing that movie for the first time too. And that movie I highly recommend. And not even just for people in medicine. Yes. For everyone in general. Because it doesn't just talk about a doctor healing people. It talks about a person healing people. And helping people, period. Exactly. We can all make a difference, man. Yes. It also has some funny clips, right? Great clips. The legs in front of the gynecology conference and stuff. Yes. Yeah. Phenomenal movie. All right. So we're going to talk a little Belen and then we'll get more into Belen. All right. So I want to tie into this entire conversation we started with. How did Belen's Jesuit education and values influence your professional path? Yeah. So, the Jesuits were very big on education. That is their whole thing. Right? If I'm not mistaken, I might be completely wrong. Discipline and educating. Absolutely. Belen was a very challenging school. The Jesuits always wanted you to do more.
I always felt like they were pushing me. At least I took it almost personal.
Sure.
You know, I felt like I could do more. And Belen taught me to step out of my comfort zone many, many times, especially more in high school. I played in the band.
Okay.
And we used to perform, you know, in Calle Ocho. We used to perform in Disney World to compete. So stepping out of my comfort zone and doing things like that. Teresa Martinez would used to have newscasters and stuff like that, news reporters, whatever, come to the school, and she would pick me out of school.
Intimidating, right?
Yeah, super scary. She's like, Kenji, come here. It was like, okay, you're doing this interview. And I said, okay. So
First interview ever on the news. Like,
yeah, exactly. I'm like, dude, I'm like 15. What do you want me to say? It's kind of scary. But they pushed you. They pushed you to do more. And through medical school is a grind. It's hard. There's moments, actually, no, like almost every day, you want to give up because it's so hard. But I would always think back about my time at Belen and about, you know, the teachings that I would get. Mm-hmm.
I love that. So on that same direction or topic, right? How do you apply these values and teachings in medicine, particularly?
Yeah, well, I use the Belen model all the time, man. I mean, it sounds cheesy, but men for others is what I do all the time. I'm a man serving other people. You know, I see people at their most vulnerable state, when they're sickest, when they're depressed, when they're anxious, and it's my job to help them. So men for others is what I live every day, and as well the AMDG, ad majorem Dei gloriam, for the greater glory of God. You know, everything I do is because he's working through me. I do it for him.
Yes.
So yeah.
For him, through him, for everyone else.
Yeah, absolutely.
Love that. All right, so let's talk some more Belen, but a little more Belen.
Let's do okay.
All right. You mentioned band.
Yeah.
Right?
Yeah.
Were there any other clubs, sports, or extracurriculars you were involved in?
Oh my God.
All of the above.
Yeah, I think I did more extracurriculars than studying at Belen. But definitely. So band, I did it since 6th through 12th grade.
Okay.
And that was for me near and dear to my heart always. Very grateful for that opportunity.
Goes with the fact of, you know, maybe why you love music.
Exactly.
Yeah.
Exactly. And man, Belen had, it still does, one of the best musicians ever. You know, my drum teacher, Ruben Jimenez Tuti, was amazing, led by Marlene Urbay, who she's big time in the Cuban community in Miami, everywhere. So yeah, band is near and dear to my heart. I did musical theater as well. That's where I met my wife.
No way.
Yes,
Nice.
Doing musical theater at Belen. Started Operation Smile at Belen, which was another club. Did Athletes for Charity, peer ministry, student council as well. I was a vice president of Belen for my class.
How was that? How was that like?
That was that taught me a lot. As well. That taught me a lot about how to work with people, how to deal with people. And
different type of people too, right? Like it's a lot of things coming at you, a lot of decisions, and you're almost representing, not almost, you are representing, right? At the end of the day, the entire class and the entire school at a certain point, right?
Exactly. You're the middleman, right?
Yes.
You're trying to defend and you're working for your classmates, but you're also working with the administration.
Correct.
So you're trying to find a good balance.
Correct.
And I was very fortunate and lucky enough to work with an amazing cabinet, just a group of guys that I still love, and you know, we learned so much.
Who was the president of your class?
So Steven Tyler, we used to Tato Tyler. Yeah.
You all had nicknames. What's going on?
Yeah, everyone had a nickname. We never called each other by our first name.
I've known you 20 years. I don't even know what your first name is. What's going on here? Yeah. So our VP was Jordan Sanchez, which is also holds a dear place in my heart as far as the original co-host on this podcast.
Nice.
And you know, we'll leave it at that. But there's some things in the works for a future episode that's going to be great.
Nice.
What did you like about the VP thing?
Let me see. Let me see. How can I say it? What did I like about it?
Yeah, because you know, maybe there's a junior listening to this right now, and he doesn't know that he would like to be a VP of his next senior year. Okay. Right. So, what did you like about it that you know? Because I'm sure you took it on not knowing what you liked about it. Right? It's the first time being a VP of the school. So, how, you know, what did you like about it?
I like the sense of responsibility that it came with it. To be honest. I love quotes. Again, I'm sorry. And I'll quote my favorite superhero movie, Spider-Man.
Okay.
With great power comes great responsibility.
Love that.
Right? So as a vice president of the school, not only are you representing yourself, but you represent Belen. And having that responsibility, knowing that, okay, I am the face of my class and of the school. I have to be on my best at all times. I have to, you know, to show up with my tie buttoned up and my button tie.
Be the example.
I have to be the example.
Absolutely.
So I kind of like that pressure and that responsibility that it came with.
Love that.
Yeah.
What are some things you took from it?
Man, organizational skills, one, that was huge. And just learning, again, how to work with people. learning to work with adults at a time where I was like 16, 17 years old. But here I am talking to adults and learning to take no for an answer sometimes, learning about rejection. There were things that we would pitch the administration and they would be like, absolutely not.
Hard no.
Yeah. And I'd be like, well, okay, back to the drawing board. So failing and getting back up.
Quick shout out Wolverine basketball for my class. We know what that's about. We'll leave that for off camera.
I want to hear that episode.
Oh, yes, you do. What was the gaming council of choice in the VP president office?
So we actually had the gaming console in the senior lounge.
Okay.
So in our office, we didn't have the console.
Nice.
But the big one was the N64.
Okay.
We used to have the N64, GameCube, PlayStation. But the game of choice was always Smash Brothers.
Love that.
Yeah.
Love that. Yeah. And four controllers and go at it.
Lots of screaming, lots of fighting. It was great, man. Yeah.
Love that. I don't remember the senior area having a gaming console when I was there. So the fact that maybe that transitioned is awesome, right? Kind of broadens the group. But man, in the VP president office was 40 people at one time sometimes. So maybe it was the senior lounge for us. And that's why I'm not thinking of them together. So that's awesome. All right, more Belen. Favorite Belen memory?
Oh my goodness. So many. 7 years of memories, man. 7 years. I'll give you a couple if that's okay.
Sure.
So in 2012, I was a part of the baseball team that played the first ever game at Marlins Stadium.
Okay.
And that was an incredible experience. We ended up losing. We played against Columbus.
Okay.
We lost 6-4, but just being a part of that history, was huge.
We'll cut that out, by the way.
Oh yeah, don't put the Columbus
losing
part.
to Columbus. We'll cut that out.
Don't put that part, please.
I'm kidding.
Playing in the band again, competing in national tournaments in Orlando and stuff. Those trips were always amazing. But one of the most amazing memories that lasts in my head forever is a trip that we took to New Orleans with the student council. It was our cabinet, me, the president, treasurer, secretary, and we were taken to New Orleans by car with DQ and Victor Arrieta.
Holy moly.
And
Did Victor run there?
No, he drove. And we have stories of that trip galore. We went to go visit another Jesuit school.
Love that.
New Orleans Jesuit. I'm sorry.
Love that.
And we had a great time.
Loyola's out there too as well, right?
Yeah. We went to go visit Loyola, visited Tulane. We did a lot. We went to a Saints game.
Sick.
Yeah, it was such a good time. So that's a really big memory for me.
And that's a great little group to go in,
it was great. It was great.
Something you don't forget.
Yeah.
Something else I don't forget is lunch.
Oh, my favorite.
Okay. What's your favorite lunch item?
Okay. So
it's different depending on this is a decade question.
Really?
80s has an answer. 90s has an answer. Early 2000s has an answer. 2013, no pressure. You're representing the decade.
Man, this is tough.
What's the favorite lunch item?
I hope to say that everyone in my class would agree, but I don't know. But mine personally was chicken patty.
Yes.
Yes.
Love that.
I remember chicken patty was so much fun because everybody would sneak like 5 in their pockets.
That was going to be my next question. Were you only allowed to take one while you were there?
You were allowed to take one,
right,
but you ended up taking like 4.
It could be, it is April, 450 degrees.
Yeah.
And you're putting on your sweatshirt to go to lunch.
Always.
And nobody knows why the hell you're putting on your sweatshirt. And it's for the sweatshirt pocket so you can sneak two chicken patties in there when no one's looking.
Yes, sir.
Absolutely. Throw a slice of cheese and you're out the door, dude.
Yeah.
It's ready to go. Love that. Chicken patty and then, obviously churrasco day. But that's not the favorite item. That's the favorite day.
Yeah, exactly.
So we'll be all right. I always like to shout out Richard. He kills it out there, man. Yeah. And lunch is,
can't believe he's still there. Yeah.
Crushing it.
Yeah.
And at least from when I was there till, I still visit often. Mm-hmm. You're walking into something that's very impressive.
Very.
Very impressive, especially if you're not used to that, type of lunch selection.
Yeah.
Right. You got the salad bar, the sandwich bar, the ice cream bar, the soda wall. You got the different lines, the hot meals, the cold meals. I mean, it is impressive. Yeah, and you're telling, this is for 15, 14-year-old. Dude, here's a slice of pizza, get out the way and call it a day. So the fact you get, and I think it helps with what happens after, right? As far as staying healthy, eating right, dieting right. You're not having a cheeseburger or a pizza every day for lunch, and you get into that habit. And then in college, naturally, Burger King and pizza every day. Yeah. And we don't want to, kind of end up in that road, right?
Absolutely.
Bad habit to break.
Yeah.
So, okay, last Belen question, but not the last Belen question, if that makes sense.
Okay.
Favorite teacher if you have more than one,
Okay.
right? And why do they stand out?
Yeah, that's a tough question too. So I was fortunate enough to have a lot of legends, right? So it depends on many different things. I would say, again, very blessed to have so many good teachers. The legends I had, like Mr. F, Mr. Flores.
Love that.
Miss.
Did Flores still have his cannon?
We didn't have a cannon, but
No?
No.
God bless your ears.
Well, I don't remember the cannon actually, maybe, but I don't remember.
Your
too
class
well.
maybe just never got out of line and everybody started talking at the same time.
Yeah, probably.
Boom!
We were
This
scared.
fake cannon thing that it's got to be in like a history center somewhere or something. It was impressive. But okay, so Mr. F, Mr. Flores.
Yeah, you got Miss Chirino, Miss Fernandez, Angie, right? All these people. But I think, to me, the one that sticks out the most and is near and dear to my heart, who was never my teacher, but always was my mentor, and we talked about it briefly, was Mr. DQ.
Yes.
Tommy De Quesada. I can still go to
Special
that man.
human.
Yeah, very, very special human. I text him every now and then as well. We can still talk, and I learned so much from him. Not only about education, but how to be a man as well. So, yeah, good guy.
I always talk about him every episode, so I won't. But there's a dear place in my heart for that individual.
Yeah.
Outside of the 47 Coca-Colas a day that he would drink back then, I learned so much as well.
Yeah.
And he gave me a nickname that stuck forever, B-Hair.
Be here.
Now now I'm no hair. But B-Hair was a thing for many years due to him, and yeah, man, just I talk about him every episode, so there's nothing else to say, but very special human. Talk about somebody that teaches you about integrity,
Yeah.
and staying true, and facing hard challenges like his tests, head on, and really prepare yourself for tough things, and not run away from them. And also on the basketball side, it was a little bit of momentum there too. So, nonetheless, shout out DQ.
Thank you, DQ.
Anybody else that comes to mind? I didn't want to move on.
Again, let's talk about, like, legends. Brother Jerry was a legend. But yeah, there's so many. Miss Fariñas to me was very impactful. Miss Fariñas, my 6th grade year.
That's crazy. 6th grade homeroom for me, and I was the vice president of her class, 6D.
Wow,
Absolutely.
there you go.
Me and John Eric Alvarez. Shout out John Eric.
Wow. I still talk about the lessons I learned from Miss Fariñas' class, but just her nurturing, grandmother's side.
Yes.
But also treating us as a 12-year-old, treating us like men. That impacted me big time too.
Big time.
She didn't baby us at all.
Big time.
She knew her responsibility, and as a female as well. It's a tough role.
Absolutely.
As a female in an all-boys school,
yeah.
that's not easy. But she dominated it.
Oh, no.
She was great.
It's epic.
Yeah. So I love her very much as well. So yeah.
That's awesome. So I asked you earlier if you always knew you wanted to be in the medical field, and you said yes. Outside of always wanted to serve and help people, is there anything about the actual, I guess, not medicine side, but yeah, like the more scientifical side that gravitated your way, or, was that something that came after post Belen?
I think I've always been, I've always gravitated towards that because I've never been good with numbers.
Okay.
I'm not a math guy.
Opposite here, by the way, buddy.
Oh yeah, you like numbers?
Yeah.
No, I can't.
I
do
only
numbers.
like numbers.
No, I have not enough fingers. So once it passes 10, I'm like done.
Yeah, I hear that.
But yeah, so I've always liked the sciences, and I've always kind of been inquisitive. I've
Okay.
always questioned certain things. I love knowing the how and the why. I was always that kid that on Discovery Channel, there's a show called How It's Made.
Okay.
I loved watching that stuff. Mythbusters, Bill Nye the Science Guy. I've always just been involved with the sciences for some reason. So yeah, I've
That's
always,
sick.
yeah.
So it was not a post Belen, I got to get through these tests. It was always, a natural thing that you enjoyed and gravitated to. And that's amazing. We'll point it out later, but one of the reasons I kind of even got involved with this podcast was, at a young age, I had no idea what I wanted to do. And I think that's okay.
Yeah, absolutely.
And I always highlight that. But in this situation, I also think it's okay to know exactly what you want to do and go and do it.
Yeah.
And really see it through and make, do it to your best ability, right? Not just do it because it's a thought you had from when you were a kid. If that thought changes, that's okay.
Yeah.
And if it doesn't change and it evolves even more as time goes on, that's okay too. And that's amazing, right? So
yeah, touching upon, I want to actually mention something that I think if anyone younger is listening to this, I think it's important for them to know that it's okay to fail.
yes.
More than anything.
Love that.
Yes, I may have known that science was something I was interested in, But I love, like I told you, I love music, I love dance, I love the arts and things like that. And Belen gave me the opportunity to try all of these things. You know what makes Belen special is that those opportunities to try everything and to know that, okay, you know what, I gave this a shot. Maybe it's not something I like, but at least I did it.
Yes.
So I want people to understand, do as much as you can. And if you're in Belen now, use Belen. Utilize all the resources you have. I mean, there's more clubs now than when you and I were there.
Right.
There's, I think, a club for just about everything. Get involved. Sign up for it.
Robotics and all this stuff. Like, what was that when I
Lego
was there,
club.
right?
I mean, there's so many different things. I went to Belen the other day. I was like, wow, this is insane.
Yes.
So this is your time to grow. Right now, these kids are like clay models.
Mm-hmm.
Belen will help form that model. And of course, their parents as well. But if they don't try, they won't know.
I love that.
Utilize Belen, man. Utilize everything. Go out there and don't be scared to fail. You won't know if you like something unless you try it. So do it.
I absolutely love that. I can't stand for that more. And I'm so glad you brought it up because it's something that we've indirectly spoken about, but never used, those words before. And I think they're beneficial. Yeah. They would have been beneficial to 16-year-old Bryan. That's for sure. Right. So thank you for that.
Yeah.
All right. So let's talk a little post Belen.
Okay.
You graduate. It's 2013.
Yeah.
Okay. What are challenges that you faced in college years during undergrad and, med school, kind of that transition? What do those challenges look like?
Yeah. As much as Belen is like the real world, Belen, they treat you like a man and things like that. You always feel supported in Belen. They let you fall.
Sure.
But they're always there to pick you up at the same time. Right. They don't let you fall too hard.
Right.
But when I started college, I realized that unfortunately, there's not many people there to pick you up. You have your family, you have your parents, and that's great. But the real world is tough, man. It's tough.
Just to know, you stayed local or you went away for college?
No, I'm a pause up FIU.
Nice. Yeah. Oh, wow. That's awesome.
Yeah.
Had a few on the board that were FIU. I'm FIU. You're FIU. I'm starting to think Bravo's only picking FIU alumni, but that's awesome. Yeah. Pause up on that. Absolutely. Okay. Yeah. So, there's a real reality with what you just spoke about when you go away to college as well. Yeah. Right. And that element that comes with it.
Right.
I forced it upon myself where I moved out. I stayed local, but I moved out because I wanted to live by myself. Yeah. Right. Everybody else was experiencing this if you don't wash your underwear, there's a day where you look in the drawer and there's no clean underwear. Yeah. You know what I mean?
Yeah.
It's real life things that kind of start as stupid as that and then move on. And in a medicine style education, right? 8 years plus the 4 plus the who knows the time in between if you took time. It's a developmental stage where you go in a certain person and you come out a different person.
Absolutely.
Right? Not just as now a doctor, but as a 12-year different individual, right? And are there any challenges that stand out maybe within the 12, right? You came in this way, you left that way. Yeah. What kind of comes out? And again, this is maybe selfishly for a younger person listening that might say I'm thinking of being a doctor. What does that look like?
Yeah, absolutely. So becoming a doctor is tough. I think, at Belen, thankfully and luckily, I didn't really have too many failures. I did fail, but like I said, again, there were people there to help me out and support me. In college and in medical school, that's when I really, would fail a lot.
Okay.
And I would fail hard. I'm telling you, I'm not the smartest person. My GPA was not the best. I'm not that doctor on YouTube that preaches about having a 4.7, 4.8. And I don't know if the parents would be happy to hear me say this, but
they sure will.
Yeah.
They sure will. It's reality.
It is. Yeah. It is, right? The reality of the situation was that classes got tougher. I had to study more, but I had to prioritize certain things because I loved playing sports. I loved hanging out with my friends, but I was like, okay, when it's time to get down to business, it's time to get down to business. So learning how to prioritize things and overcoming those failures. I went to medical school actually in the Caribbean as well. So I'm not,
really? That's cool.
I went to a school in Grenada,
okay,
St. George's University. And again, that's another chip on my shoulder, right? Because we always think, Caribbean medical schools, they have this connotation, but on the contrary, the school gave me the opportunity. I seized the opportunity and look where I am today.
Yes, love that.
So it's okay to fail. It's okay. But as long as you get up and you learn from it and you just get better and better and better every time.
So, 12 years of failing and learning, you were pretty good at the end of that, right? So no way around it. I love that. Speaking of that young Belen student, let's say, right? And the show's not meant for them, but let's be honest. It's a Belen thing, and I'm sure they get a little exposed to it, and hopefully they can learn from these things as well, outside of how to sneak chicken patties out the line. What advice would you give that Belen student or maybe young alumni entering the medical field? Okay, I made this choice. I'm going down this road. What's some advice for that person?
Yeah. Again, don't be scared.
Okay.
Trust yourself. You are worth it. You are here for a reason. Believe in yourself more than anything. People do want to help. Ask for that help.
Okay.
Don't feel like you know it all. The moment we stop learning, the moment we stop learning is the moment we stop growing.
Love that.
So go out there, experiment, try everything out, talk to people, have conversations with like this, like we just sat down, we're talking, and just open yourself up to opportunities. Seize the moment, I think is the biggest thing.
Seize the moment, seize the network, right? Not just Belen guys, but at the end of the day, if you just don't know who to speak to, find a doctor in the Belen network and reach out and ask, for take them to coffee, right? Or a little mentorship opportunity or an internship opportunity or whatever you can do to open that door. And I feel like that's more common now. Yeah. Luckily the school's really focusing on this and offering these type of programs and the Belen community is being very acceptive and receptive to it. Right. But I love that you pointed that out because at the end of the day, it might be a thought and you don't know, and I don't want to bother, or maybe that fear of rejection. Right. And just reach out, have these conversations and find your own support system throughout this time. So I love that advice. I want to tie that into habits or routines maybe during that time that kept you grounded, right? What outside of conversations and healthy opportunities, what were maybe some things that you without it, you're like, well, I don't know if I would have gotten through it.
Yeah, absolutely. So music is one of them. Okay. Playing instruments always brought me kind of down. Family, of course, my wife, friends and things like that. But another thing also that kind of stayed constant was my faith too. Okay. Yeah. So luckily through college and a little bit in medical school and stuff like that, I was able to play in a band for church and things like that. So still going to church kept me grounded because it was like, I don't want to say it was a routine, because going to church shouldn't be like a routine, I guess. Right. Maybe that sounds bad. But it was something that kept me grounded. It was something that made me remember why I was doing what I was doing. It gave me a purpose and it gave me understanding. Huge. Huge, man. I love that. Yeah, that was a big thing.
I love that. Something you haven't mentioned yet, and Bravo pointed out, is that you could definitely kick my butt.
That's another one.
Mixed martial arts, right?
Yeah, kind of. Yeah,
how long have you been in that? Yeah. Right? And is this something, how long have you been in that?
Yeah. So this kind of is a funny story, right? My dad went to Belen in the 70s. Sick. And my dad was he started karate at Belen. And the person that brought the karate club to Belen was Father Cartaya. Okay. This was crazy.
Key club.
So ever since then, man, since I think it was 1975, my dad has not stopped training. Wow. And so he continued. And then we have a karate school here in Miami. It's been around for 42 years now. And I've been training my whole life. I've been training since I was 2 years old, basically.
Black belt, I hear?
Yes, sir.
In karate? Because I wasn't sure which. Yeah. Okay.
So we do karate, traditional karate it's a style from Okinawa. All right. And then we also practice judo. Okay. So both styles, different styles. And that's another thing that kept me very, very grounded as well. Just practicing martial arts and that discipline, that humility that it comes with it, and always giving back, serving, educating kids, adolescents, and adults as well.
I feel like that's life's purpose. Find something you love, get really, really, really good at it, and then find a way to teach the next generation that.
Absolutely.
And if you kind of find anywhere in the middle of that cycle, there's a big fulfillment. Yeah. And selfishly a reward feeling to it. And if you could find a way to monetize it, you just hit it out the park, right?
Exactly. Like that's even huge. Yeah.
So I love the fact that I didn't know about the karate school at all. Yeah. Bravo gives me show notes, and we got, look, so the camera can see, we got 75,000 pages of show notes, right?
Sure, yeah.
If I show you what Bravo gave me, it was half a Post-it.
A classic. That's
Class of 2013, he'll kick your butt, VP, dale, bye, oye, bye. You know, and I'm like, okay, Bravo, I'll take it from here. Thank you.
Yeah.
Hey.
I'll do my own homework, Bravo.
I love Bravo, man. I like busting his chops here. So, okay, so one thing on the martial arts that I definitely wanted to ask, and you kind of touched on the toughness, the discipline that sport particularly takes.
Yeah.
Are there things that you learned in Belen that help you with this tough sport?
Yeah. Resilience.
Okay.
And perseverance.
Okay.
I think those are like two of the biggest words and things that Belen taught me that helped me also with karate, and vice versa. Karate taught me that and helped me with Belen too. So
love that. Outside of work and medicine,
yeah,
let's talk, life.
Yeah.
Human life.
Yeah.
What are ways that Belen prepared you for life outside of the toughness and the quality of life and those things that kind of apply to the work trajectory, right? But what are more things that maybe they prepared you for life at home, life with your significant other, just life?
Yeah. So Belen also ingrained like a sense of serving.
Okay.
Again, it goes back to the motto, men for others.
Yes.
Right. I'm always thinking of kind of like the other person first. Of course you got to take care of yourself, but my purpose, or I think my purpose, is to always give back. So life outside of medicine, it just is about that, is always kind of giving back. And whether it's at the dojo, whether it's, spending time playing drums at church, whether it's going to, I don't know, soup kitchens or community services and doing stuff with the other residents, the doctors that I work with and things like that. It's always kind of doing stuff for the community, doing things for other people, serving.
Love that. It's a lifestyle, because at the end of the day, it was a part of life, and one that a lot of people find grateful and gratitude in, coming from Belen. So, all right, I want to kind of transition into 17-year-old you.
Oh God.
Okay. We got 17-year-old Kenji. I don't know when your birthday is, but I'm going to assume you were a senior.
Okay.
You were a VP at the time.
Yeah.
What would you tell that kid?
Get ready.
Prepárate, ponte la pila, que we're coming in hot.
Life is a roller coaster.
Yes.
Belen, again, is a special place. It's a bubble at the end of the day. I love to think that, you're with the same guys. I was with the same guys for 7 years every single day, right? I would wake up and do the same routine, go to the same classes and things like that. But unfortunately, life gets more difficult. Life is not a bubble. You're going to be with other people. You're going to have to work with other people. You're going to have to deal with rejection. You're going to have to deal, not everyone is a Belen member.
Right. That's for sure.
Not everyone understands the culture. Not everyone has the same sense of humor as us.
Oh, that's what I had to learn big time.
Yeah. And I have stories about that in college too.
My significant other, I drive her crazy.
Same.
I drive her crazy. And I'm like, you don't get it. This is how we show we love each other.
Exactly. Exactly. So yeah, I had to get used to that. I was like, oh wait, this is different.
Right.
This guy didn't go to Belen or whatever.
Right.
But nothing, man. Just I would tell 17-year-old me that there's light at the end of the tunnel, and just keep doing what you're doing, man. Continue to grow. Never stop growing. Never stop learning. Always question everything. Think about the why, the how, the what. Never lose that fire. Yeah.
Never lose that fire. Interesting choice of words with the fire and the whole. Well, meant for others and yeah.
What? Yeah. I'll touch upon the fire actually later. It has to do with DQ as well.
Okay.
Yeah.
Let's touch upon that right now.
Okay. So, our senior year, our first day, senior year, I'll never forget. DQ sat us down in the auditorium, and he gave a classic DQ speech. Paper in his hand, classic coach, Don Shula type of motivational speech. And his first words, and I'll never forget, and this is a shout out to him because it still hits me. He goes, "You gentlemen have accomplished nothing." Like that.
Welcome to the auditorium.
Yeah. We just started school. He goes, "You've accomplished nothing." And then he goes on to explain how, as seniors, we need to set the bar high. We need to set the standard because we are the example for everyone. For that 6-year-old, that sixth grader, that 12-year-old that just started, they're looking at us. We are the top dogs. So he was mentioning that as a class, we needed to accomplish something. We needed to be better. We needed to, continue to grow as men and together as brothers. And that was around the same time that Batman, the Dark Knight, was coming out. So the motto for our year was "The Fire Rises," and we kept that very near and dear to our heart. You know, keep that fire rising, keep that fire hot. So,
and here DQ thought that all you guys were sleeping and not listening to him.
no, I listened to him very much.
Look at that. Years later, however many years later,
yeah.
you know, you're reciting the message of that. And it just goes to show how impactful some of these people are.
Big time.
Some of these individuals are in our lives.
Yeah.
And it goes on example after example. I sit with all types of professions. And the way that everybody ties something that they learned from someone there and that they remember, whether they're 50 years old or they're 30 years old or everything in between.
Yeah.
It's not things you forget because of how impactful they are.
Definitely.
And I think playing sports, there's a lot of that. Yeah. You know, from my size, I'm sure you could imagine I was a tremendo football player. Okay. But that camaraderie, with us, and I don't know, you know, years later, the locker rooms got way nicer. But, you know, we had this yellow plastic code or I forget, but, you know, pride, courage, right? And it was like this anthem, right? I'm not using the right word, but this thing that we stood for. And for years and years later, you recite to it. And I can still remember every player double tapping the bottom right corner because we took the screw out on purpose so that it made that plastic hitting the wall sound.
Nice, yeah.
And, you know, just that unity. And you don't forget that, regardless if you're good, regardless if you're bad, regardless if you played. I didn't play much. You know, it's you take that with you. And you know, here at Rockwell, right? There's this team camaraderie that I learned there. There's a code that we, you know, go by. There's standards that we set. We're always trying to, you know, encourage each other to do something better than we've done.
Right.
And I'm blessed to you know, at least I feel very grateful to have that.
Yeah.
Because it adds to what you said in the beginning of the podcast, which is like purpose.
Yeah.
Right. It gives purpose to just. Purpose already is like just try to be better. That's a good purpose.
Absolutely.
You know, and you'll achieve it. And if you work hard at it and that self-rewarding feeling and how important that is to everything. So I'm glad I brought the word fire up and we went in that direction because it gave me goosebumps, you know, and I can see DQ up there kind of like smacking the paper on his hand, like you said, you know, and like you haven't done anything.
Yeah,
so
exactly.
I love that. Last question Last question before the outro. Okay. There's a few questions in the outro.
Sure.
Any books or podcasts that you recommend? Again, maybe someone out there that says, "Oh, I haven't heard of that book or podcast. Let me check it out." It could be for life reasons, or it could be specifically, you know, medicine wise.
There's a lot. There's many, right? For the avid listener, you know, I'd like to listen to Huberman Lab.
Okay.
For example, Dr.
Sweet.
Huberman Labs is great, but his podcasts are super long.
Yeah.
Very, very long, very extensive. Sometimes he goes too in depth that I'm even confused. I'm like, what are you talking about?
How do we end up here?
Yeah, exactly. So it's a little extensive. But to be honest, I don't really recommend that much to my patients or to people in general. I just tell them, find something you enjoy listening to, find something you like. Take everything with a grain of salt. I think that's the best advice I can give. You know, if you want to listen to something, listen to it, but take it with a grain of salt. Still do your research, do your education, do your learning, you know, always be inquisitive. Don't take everything everyone says as fact. You know, don't take it as 100% because sometimes you don't know what agenda they have as well.
Absolutely.
And again, it's not to say that it's a bad thing, but just be curious. Always be curious. But yeah.
What about book wise? Because I mean, any teacher that's hearing this is like, that guy didn't read in high school, right? There's no chance. But now that viejo, I spend a lot of time reading.
Yeah.
And you know, if I would have heard someone cool, successful, maybe recommend a book, maybe I would have read that book in my early ages. And I know how much value I get out of them now.
Yeah.
So, you know, no pressure. If there is nothing that comes to mind, then, you know, go find a good book on your own. But is there a book that stands out that maybe you read in those 12 years? Like, I didn't have time to read. You know how much, you know, stuff I had to do for school?
There's a lot, There's a lot.
Is there, you know, something that maybe captured and you're like, I'm glad I read this?
I don't know how Belen's going to feel about this one,
okay.
Right? But a book that I recently read, I would say like in the last year or so, it's a book by an author, Jay Shetty. And it's called Think Like a Monk.
Okay.
And I love that book very, very much because it taught me, how to be grateful, how to live in the moment, how to be thankful for those failures and things like that. So it was a very reflective book, and it talked a lot about lifestyle and, again, mental state. Monks are very at peace. They're very, again, grateful and things like that. Again, it might go against our religion. I don't know, but
we'll figure that out.
Yeah, we'll figure that out. But it was a good book. It was a nice book that I read recently. Think Like a Monk.
At the end of the day, it's the messages you took from it, not the practice or the religion side of it. So,
correct.
Read with caution.
Exactly.
All right. So as we reach the end of the show, it's tradition. Okay. This is the podcast tradition.
Yeah.
Okay. Right above your head, it says Because Belen Podcast.
Yeah.
The name of it. Thank you, Father Willie. And so we always ask, what is your Because Belen? Because Belen, fill in the blank. ...
It's a good question. Wow. 2 words that really hit, right? I think I would say, because Belen, I am the man that I am today.
Love that. Love that. You went in a boy, came out an older boy, and has formed, the man that you are today.
I think so, yeah.
Couldn't agree more.
Thank you.
Love that. Love that. Okay, so a few promotional items. December Tombola Challenge. Highly encourage everybody to please participate. Very important for the school. Very important for everything that we get as far as opportunities and the gratitude of it. Reminder, please follow, share, like, comment, whatever you feel fit. If you got some valuable information out of this podcast, sitting down with Kenji Martinez, drop a comment, say thank you, say whatever you like. It really helps the algorithm. It really helps other people find this amazing platform. And so we ask that you support it in that way. Remember, be connected. Please use it. It's out there. If you want to get involved with mentorships, internships, reach out to the board. Extremely available and extremely excited to hear from you. Absolutely. So however you'd like to see fit. I'm extremely excited. Okay. Next episode, we're bringing back Words on Fire.
Oh, nice.
Popular segment. People seem to love it. Wasn't ready to go for today, but we have a pretty cool way that we're doing the next one. And after that, it'll be back in the programming. Okay. Want to thank you.
Thank you, man.
Dr. Kenji, not just for the time and everything, but all the valuable information that you just blessed us with. I think perspective-wise, it's a huge thing for young, middle, and old to hear from someone, that they might have said something that relates to them. It might have said something they never thought of. It might help them ask the why or the how, right? And anything that may have come from this episode. So thank you so much for taking the time. Thank you for making the drive. Thank you for being here. I want to thank Belen, naturally, giving us so much, more than I could include in this little 30-second clip. So thank Belen, thank all the teachers, thank the foundation that it's provided, so many. Thank you for the opportunity of doing this podcast and really bringing this project to life. Beyond grateful for it. I want to thank the team here at Rockwell Talent for powering the episodes, editing the visual components and everything in between. Make sure to follow Because Belen, okay? And Kenji, you want to plug in your socials?
Yeah, you can find me on Instagram. My social is Dr. Kenji _Martinez. Dr. Kenji _Martinez. Yeah.
Dr. Kenji _Martinez. This has been an absolute pleasure.
Thank you, man. Okay. Thank you for having me.
I'm glad we connected. Thank you, Bravo, for bringing this suggestion up. It's been a very valuable one. And on that note, until next time, Our Lady of Belen,
pray for us.
For us.